I was very surprised to get the news, oh boy, I've got stage 4 prostate cancer. But the question wasn't, what is it that I have? The question was, what am I going to do about it?
At Weill Cornell, we have a very strong program in genitourinary cancers that includes prostate cancer, bladder cancer, kidney cancer, and testicular cancer. We also have really across the board top-line medical specialties that's all here within one roof.
It's very important to be connected to a hospital such as New York Presbyterian. We have a great faculty that's at our disposal. It's a multidisciplinary team, not only the medical oncologists, but we also work very closely with our radiation oncology colleagues, our urology surgeons, from pathologists to radiologists.
So whenever we see a new patient, we present the patient at a tumor board. And at that tumor board, there's the whole gamut of physicians involved in care. What makes us unique is our dedication to research. And when I say research, not only laboratory research within the cancer center, but clinical research. And we have our own clinical trials.
I think the benefit from participating in clinical trial from the patient point of view is multifactorial. Sometimes there's access to a drug that otherwise would not be available. And some of these are very promising. And we know today that there have been improvements in almost every cancer that there is through clinical trials.
Some patients have the misconception that clinical trials are for the very end. That's not true. Clinical trials are for every stage or state of your cancer.
One of the great things that we have at Weill Cornell is our Institute for Precision Medicine.
As a team, we've really been highly focused on precision medicine, and this is really approached to try to identify which patients might respond the most effectively to the available therapies that we have. And we do this by looking oftentimes at the molecular alterations in their cancers.
Coming up with treatments that are targeting that defect and be able to treat patients with more personalized treatments rather than treating everyone the same.
I'm not a number, I'm a person. And because of precision medicine, I'm here today. It is a wonderful, wonderful thing, and I'm very, very fortunate.
In all the diseases in GU cancers, there's been remarkable advancement. I mean, patients that would have died are alive and living for years.
Our mission is really putting patients first. I think that everything we do in the clinic as well as in our research is driven really by the patient.
From the very beginning, when you go to the check-in desk, you are like in a big family. You know that you are in good hands and you are like at home, like a second home.
We are very respectful and very caring towards our patients from the day that they step foot in this hospital. To care for a patient to the best of your ability, you truly need to encompass the patient entirely, from their family members to their caregivers, their beliefs. You know, you're treating a human.
If it wasn't for the GU Center, if it wasn't for Dr. Nanis, I would not have been able to go to 3 college graduations, 2 of my granddaughter's weddings, and the birth of 2 beautiful great-grandchildren. So all I can say is thank you.